Hi again, François Houÿez from EURORDIS to explain you one more tool you can find on the HTX PROM Select app. This is for those who are more expert in using Microsoft Excel, a line listing of all the patient-reported outcome measures that you can find on the website, and you will see how to use this Excel document. It contains additional information, and for some it may be easier to use than the online app. So this is the Select app, and on this site you can select to have a view at the PROM Overview, which is an Excel database. And this is the Excel database in question. So you immediately understand why I said that it's probably for those who are more familiar with Excel. But one first element is that you have here 662 patient-reported outcome measures for different diseases. So it's quite a comprehensive document. So how to help you navigate in this document? When you select the first line, which is the name of each column, and go to data, it says données in French, but it's data, you can click on the filter here, and then for each column, you can filter. For example, for health problems, you have the list of all the health problems for which you can find patient-reported outcome measures in this document. So for example, you unselect them all, and if we go to multiple myeloma should be approaching here, click on multiple myeloma, and your search will extract those which are specific to multiple myeloma in the health problems. So for example, let's click here to the site where you can find the PROM itself. And this will open the page where you can find more information on this tool. So you see you have 41 items, 41 questions. It was designed for patients with multiple myeloma of 18 years and older. And you need to remember what happened to you in the last 7 days. So that's called the recall period. And then you have more information. It exists both as paper or electronic systems to collect the data. It is self-administered, or you can respond to someone interviewing you, asking you the questions. The domains explored by this tool are your physical well-being, social family well-being, emotional well-being, functional well-being, and it should be completed in 10 to 15 minutes. So for example, let's download the document in English. But before, you may be interested to see which other languages are available than English: Chinese simplified, Czech, Dutch, English, French, German, Greek, Italian, Portuguese, and Spanish. So back to the download. You can download a PDF or a Word document. So when downloading the PDF, this is exactly as per the website, the app, access to the PDF document, where you can find the questions for the FACT-MM quality of life scale. And again, for physical well-being questions, I have a lack of energy, I have nausea, I have trouble meeting the needs of my family, I have pain, I am bothered by side effects of treatment, I feel ill, I am forced to spend time in bed, not at all, a little bit, somewhat, quite a bit, or very much. And different questions for social family well-being. I feel close to my friends, my family has accepted my illness, and I feel close to my partner. And then one question on your sex life. If you prefer not to answer, you can tick the box. There are some intimate questions which are handled this way. Emotional well-being, if you feel sad, how you are coping with the illness, how you're fighting against the illness, if you feel nervous, if you worry about dying, if you're worrying that your condition will get worse. Functional well-being, if you're able to work, to enjoy life, to accept the illness, to sleep well, to enjoy things you usually do for fun, if you are content with the quality of your life right now. And then you have additional concerns, certain parts of your body where you have pain, if you feel weak all over, if you get tired easily, if you have trouble concentrating, if you worry getting infections, if you're discouraged, if you have bone pain, etc., etc. So quite many questions, 41 items, 41 questions, quite detailed. So maybe not to be administered too often because it takes time, and probably developed with patient organizations, patient representatives. So let's look at which other information you can find about this. So here, the first column, it's for patient-reported outcome, a classification. One, as we can read here, is for health-related quality of life. There are other types of tools, like 4 focuses on depression, emotional distress, well-being, anxiety. So here one, it's all functions, all domains included. The second column is the source where HTX found the patient-reported outcome measure. The second is the name of the PROM, of the patient-reported outcome measure, and the one we just looked at is called FACT-MM, Functional Assessment of Cancer Therapy for Multiple Myeloma. And the dimensions which are explored with this one, physical well-being, etc., as we just saw. Health problem is multiple myeloma, but at the end here, you can also access link to validated scientific article, link to other documents, and to search in a PubMed, etc. You have many different information. The number of levels, 5-point Likert type scale. It's the 5 responses from not at all to a lot that you can respond. So the type of PROM, it's not. And the method of administration, whether it's electronic or paper, and this one was both. You have other information which you can look at after. The country it was initially developed. Here it's not documented for all languages. It only say Chinese, but it exists in different languages. We just saw that. It's for adult patients. It was developed in 2012. And here, were patients involved in establishing which outcomes to measure. And 1 is for yes, 0 is for no, and 2 is limited. So in this case, it's 0. Focus groups, none. Interview, no interviews. But patients involved in the development of the items, yes. And the other where patients were involved is for items that were derived from other patient-reported outcomes or other non-patient sources. It's not exactly on patient involvement. So for each outcome, you see the type of involvement of patients in their development. And sometimes it's not totally detailed. So if we look at other diseases, so we go back to health problem, and we may select another one. For example, let's look at COVID, a generic for COVID. So we have just one other tool. And again, you can find information that it's on general quality of life with COVID. If you click on the link, you will access a website which will load the tool in question. I'm afraid on this one, you need to pay to access the document, to access the questionnaire. So you need a login or register for free or submit your request. So maybe not with a payment, but you need to register to access the document. I did not register, and I will not register immediately. And so you can really explore according to disease conditions of interest to you. There are questionnaires for mental health, for multiple sclerosis and diabetes, and osteoarthritis, Parkinson. Not all diseases are listed here. There are more PROMs than here, but it's an organized and systematic document listing all the tests that exist. For pregnancy, one is listed, but only via a scientific paper. There is no link to the PROM itself. So sometimes the information is missing, is not fully completed. And for example, agoraphobia. So you have again a questionnaire. I think this one is a questionnaire on panic assessment. Just wait for 1 minute to load the document. And then it's questions. You may answer yourself, or someone may interview you. Please indicate the degree to which you avoid the following places or situations because of discomfort or anxiety. Rate your amount of avoidance when you are with a trusted companion and when you are alone, with the following scale: never avoid, rarely avoid, avoid about half the time, avoid most of the time, or always avoid. So for example, do you avoid theaters when you are accompanied, when you're alone? And the same for supermarket, department stores, restaurants, etc., etc. So a long list. And then you have open spaces, or riding in buses, trains, etc., etc. So different questionnaires exist for completely different purposes, to explore different clinical situations, different health problems, hence the necessity to really discuss with your colleagues and healthcare professionals on what questions you are seeking responses for. And then once you know what you want to measure, then you can explore the tool and see if one can respond to your needs. So I think you understood the principle of this document. It's again the same products, the same information than via using the app, but this one is via an Excel document, which requires a bit of experience to navigate through. So that's the overview of all of them. There are different sources that you can also access in this document. EURORDIS that would focus on all the tools for cancer, but the PROM overview, I think, is really where your curiosity will be the most satisfied. Again, not all diseases appear here. HTX focused on 4 case studies and COVID plus other diseases for which a tool exists, but it's not exhaustive. There are other PROMs that exist and in other databases. And if you are exploring, if you have questions, if you would like to learn more on where to find a PROM, if you can't find it here in your database, in this database, please contact us at EURORDIS or contact the HTX team. And with this, I thank you again for your attention.